Do you feel scared of public transport? Petrified of traveling across bridges? Get terrified when you're in traffic jams for no possible reason? Well, this could be signs of agoraphobia, a very peculiar phobia which affects about 1 to 2% of the people during their lifetime. I am Dr. Kedar Tilwe, consultant psychiatrist, and we shall be discussing this condition, very common and yet very underreported. Agoraphobia is the fear of a situation turning unsafe or from a situation where escape may not be possible. Also, by its corollary, it encompasses situations in which help might not be available. So, agoraphobia is a very common condition. Like I said, up to 2% of the general population. So, how do you handle this? Well, first you need to know the signs and symptoms. Typically, a panic attack occurs when in a situation where help might not be available. This can include, like we had mentioned, bridges, public transport, open spaces, social gatherings, cinema halls, crowded spaces. It can also sometimes occur when you are trying to fly. There is no particular reason or precipitant, but an uneasy sensation occurs. Panic attack typically consists of 15 minutes of building up, 15 minutes of maintaining, and 15 minutes of disappearance of intense symptoms of ghabrahat, palpitations, coldness of the extremities, feelings as if someone is choking you, shortness of breath, giddiness. 4 out of all of these symptoms are required, and they disappear without any provocation also. But when they do occur, it's extremely intense. Now, because of these symptoms, a person starts to fear and avoid situations which could lead to an panic attack or where the agoraphobia may be precipitated. It can also lead to situations where a person might feel there will be social embarrassment, and so he will avoid or she will avoid stepping out of the house for the simple fear of social embarrassment or a panic attack occurring. While a very common condition, a very easily treatable condition, this causes a lot of morbidity. So, what do we do if these are the symptoms you have? Well, remember that these symptoms need to last for at least 6 months before treatment and before diagnosis. However, if the symptoms are very debilitating, we do not have to wait for that span. How do you manage it? Well, everything has to be classified. So, we'll classify the treatment also. First thing is lifestyle alterations. Then comes things that you can do at your home. This includes relaxation exercises. We'll talk about CBT, and finally about medicines. Lifestyle alterations which they have to be factored in when you try and handle agoraphobia include reducing coffee intake, stopping the alcohol. Remember, self-medicating with alcohol does not help. Over a long run, it just disarrays your symptoms completely. Avoid cigarettes, and that's about it. Relaxation exercises help. Known panicogens have to be avoided. Therapy, including CBT and REBT, can have beneficial effect. However, the symptoms, if they are pronounced, they may require treatment with SSRIs, SNRIs, and sometimes SOS treatment with benzodiazepines. So, if you feel these symptoms, do reach out to a psychiatrist near you. They will be happy to help. Thank you.